So why would somebody get pain up the back of their leg when they're driving? So if you think about the position of a car seat, the seat is relatively low to the floor compared to a regular chair. What that does is it puts you in more hip flexion initially. So you're in more hip flexion than we would be, and sometimes in a regular seat, our hips are up above our knees, and that's actually ergonomically how you should have your work chair positioned. Your hips should be above your knees. In a car, that wouldn't be the case. If you bent your knee up, your knee would be above your hip. So you're getting a lot of hip flexion. Then we extend the leg out straight, and we're even dorsiflexing at the ankle. That whole L position tensions your sciatic nerve chain quite a bit. It does increase stretch on pretty much all of the structures of the posterior leg, but it's really more the nerve tension typically of what people are feeling. So it could be in your calf, it could be down by your ankle, it could be up in your hamstring, or it might even be in the back of your hip. But 9 times out of 10, because of your overall body position, remember the nervous system is one continuous sheath of tissue. So when we are putting our body in that forward bent position, it tensions that entire nervous system leading down to the sciatic nerve and down all the way into the bottom of the foot. So when we're there for prolonged periods of time, nerves don't like to be held on tension. And you can think about most structures don't really. If you take your finger and you just hold it back for 10 seconds, it's fine. If you hang here for 3 minutes, you're gonna be screaming. And that's what, when we're driving, a lot of times it's that prolonged tension position that our body is telling us it doesn't like. Now, why does the right leg do it and not the left? Well, one, your right leg's extended out. So because you're extended at the knee, the left leg's normally bent, so the left leg rarely bothers you. The right leg's the one that's more tension. And you may also just have a right-sided issue. That's possible too. In terms of other things, I'll be honest, that's 9 times out of 10 what I'm gonna jump to if somebody's, because it's an unloaded position. It would be odd for someone to have pain when they're driving, and that would be like the 10th thing down the list for them to tell me otherwise, because it's an unloaded position. So if you have pain when you're driving, your other muscles, tendons, ligaments are not very loaded. You're not even weight bearing. So it's a nerve tension position. So that's where to look first. They could have a posterior hamstring strain that's just getting pressurized by the seat, but that's pretty unlikely. So definitely check nerve if that's what's going on. The other thing I should add real quick, and this goes along with nerve, but you're in a posterior tilt position because of the amount of hip flexion and oftentimes the seat structure in general. So just note that when you're hanging out in a posterior tilt for a long period of time, those lumbar discs are migrating posteriorly towards the spinal cord as well. So if you do have a disc issue, that's potentially what's causing the nerve pain. The pain is still nerve, but it may be primary or secondary nerve, meaning it may be primary low back, secondary nerve, or it may actually just be a nerve inflammation tension issue if you've got a nerve root adhesion or just some irritated sciatic nerve tissue. So either of those are options.